On Friday the 1st of August 2014, 59-year-old Jeremy Thompson from Bournemouth was rushed to the Royal Bournemouth Hospital Emergency Department with a severe urinary tract infection. In pain, short of breath and passing blood in his urine, Jeremy's condition was already extremely uncomfortable. It was also about to get worse.
I was been very poorly for a few weeks at home, and I decided not to go to work that week and went to the doctors. And he said to me, "Oh, you have an infection." Gave me antibiotics, which didn't really work, and I was passing blood. And by the end of that week, I'd collapsed, and my wife called an ambulance, and I went to Bournemouth A&E.
When Jeremy arrived at the Royal Bournemouth Hospital, he was feeling pretty awful, but for the first 6 hours of his admission, his condition was stable.
Whilst Jeremy was in A&E, he was treated really, really well, and I felt that they had everything under control.
Jeremy was reviewed by a senior doctor during the morning Saturday ward round on the 2nd of August, and his notes were left that he needed monitoring, but there was nothing to indicate significant cause for alarm or urgent action. This comes a few hours later at 10:30 a.m. Jeremy's vital signs at this time show he is seriously at risk. His breathing is shallow and rapid, he is suffering rigors, a temperature of 39, a pulse rate of 130 and a respiratory rate of 32. His vital pack chart shows that he has an early warning score of 8, so Jeremy is going downhill rapidly at this stage.
With signs like this, sepsis should have been suspected immediately and urgent action taken. But in Jeremy's case, it wasn't.
I arrived at 2 and was quite shocked to see how he deteriorated from when he was in A&E. And at one stage, Jeremy said to me, "Should I be on intravenous drugs and fluids?" And I said, "Well, I don't know, I'll go and find out for you." Went to the nurses' station and they said, yes, of course he should be on the drugs. And I said, "Well, he isn't." Half an hour later, he still hadn't been put on his intravenous fluids and drugs. It took 3, I won't say moans, but I had to go and sort of keep saying to him, "Can you come and put him on fluids?" We were told how important it was. When he was finally put on the fluids and the drugs, he then kept saying he felt sick. He just felt like the pain was 8 out of 10, 9 out of 10. He was definitely getting worse. I voiced my concerns to probably 3 nurses, but one in particular, who just kept saying that she knew what she was doing and he was fine, he was fine. I got really concerned when they were giving him more and more morphine, and he became much calmer, said that the pain wasn't as bad, but it was like he was just going into a deep sleep. And I thought, he's dying. You're not listening to me. What I'm telling you is that if Jeremy's saying the pain is now 10 out of 10 and he's now gone very, very quiet, this is not Jeremy. And once again, I was told that they knew what they were doing and he was fine and there was no need to worry. And yeah, so from that moment on, I felt that he was fighting for his life and that was something that should never, ever have happened. It should never have got to that stage.
So what we have here is a situation where a patient is not only showing numerous red flags, but his wife is also extremely concerned and making those concerns known to our staff, but nothing is happening. I think a key moral of this story is to trust your instincts. If your patient is showing red flags on vital pack and or their relative is extremely worried, it is critical to escalate. Don't wait.
At 6 p.m, 8 hours after Jeremy began to dangerously deteriorate, a worried member of staff took action and called for direct support from the Trust's outreach team. Specialist nurse Mark Knight responded.
Took one look at Jeremy to know that this gentleman needed urgent attention fast. My every instinct told me that this was severe sepsis. His vital signs backed this up. His wife Linda was beside herself with worry, repeatedly telling me how unusual this was for a husband to be so ill. We transferred Jeremy rapidly to the intensive care unit, where he was given antibiotics, high flow oxygen and drugs to maintain his blood pressure.
So then I was taken to intensive care. Well, I was sedated, I suppose, and unconscious, and taken for this and that. But the strange thing is I could hear everything. And then I was brought out of whether I was asleep or intensive care, whatever they do, and they tell me I'm sepsis and they've got to do this and do that. So I left intensive care, was taken to a ward, which in my opinion was a safe haven. because I had just gone from somewhere that was bizarrely intense, and then now I'm in this with other people, and I thought, this is better, I must be getting better. But I was very poorly, and Linda and the nurses adjusted to my lifestyle then, because I was moved in for 5 months or more. And then I got moved to a side room, which was fine, but then because of the volume of things that had to be done to me, it was 24 hours. I would be woken up at 3 in the morning, 2 in the morning, and so forth. I was told I wouldn't be going to work again, and so Linda and I had no income coming in, and we had to manage our home still. I think it was harder for Linda because she had to go home to no one. At least I was in a hospital with lots of people.
Jeremy is still with us, but had that phone call come any later, I feel he would have deteriorated further and possibly had a cardiac arrest. My advice to any member of staff in this situation is trust your instincts, look at patients' vital signs and listen to loved ones and escalate early. The medical and surgical teams would rather hear about 100 patients who do not require critical care input if it prevented a further situation like this occurring in the future.
Though sepsis didn't kill Jeremy, his life will never be the same.
Even when I was in intensive care, I was conscious of Linda and I financially struggling because I'm self-employed, so is Linda. And I think one of the things I said to her when I woke up was, have we sold our house? And she said, no, and I was conscious of that. And it's a year on and I can still only work so many hours a week. We do have problems surviving, but we will survive. Because if you can survive with your life, you can survive financially.
It took a concerned member of staff 1 minute to call outreach with their concerns, but that member of staff's call and Mark Knight's fast review saved Jeremy Thompson's life.
When I was in intensive care, I couldn't remember much, but I owe Mark my life. I can say thank you, but
Because Mark listened and you acted, that was the thing. So many people shouldn't end up with sepsis or severe sepsis. It should never ever get to this stage, I don't feel.
Will your next patient survive sepsis? It's in your hands.
it didn't start out well, but it got better and it got better and better.
He's a lucky one, he survived it. We just wanted to make sure that doctors and nurses were aware of what can happen if you become complacent. That every patient is an individual, every patient has hopefully a family member or someone, and you have to listen to them. They're a help, not a hindrance.